stink. Because I wonder if it's just like one of those things that, like, if you're with your son drawing water, you wouldn't even think, and then once you're in the water, you're like, oh, like you're diving in, you're like, oh.
Yeah.
I wonder if that was how it was.
Well, sure. Well,
Where was that again?
the western side.
Hmm.
Palmer, well, off of Valencia Road, exit off I-7, so it's way down.
I didn't know there were any waters there.
There's a Commission Creek, I think is the name of it, and the sheriff's small barn actually got some video of it down there, because it was a long driveway, and there's grove of trees, and you go back into that, and so there's no way for us to go down there without being on private property, but Don got one shots, and they said, hey, I can still get some video. I started to, it's swirly, and then it goes down just a little bit, and really swirly, and then so I can just see that guy being run down there. Yeah, the one that's what happened. And then now they just, the body will continue floating. So there's one station right on I-70, where Machine Creek goes under, just kind of watching and waiting to see if the body floating. And they're going to get the helicopter and all that other stuff out there too to try to find it. But who knows?
They sometimes they don't come, they just stay in there. Just like, because like the logs and stuff, you know,
Definitely.
I get to hire 3 people.
Yeah.
So we have 2 lined up, and I have 1 more position left.
Good for you. Who's the, what's the funding?
They do national companies, and people are kind of sympathetic to the lack of journalists and
So it's not going to be subscribed based like Cooper's do. I mean,
no, it'll be free and distributed to anyone who wants it.
Carpenter is getting away.
Well, we'll have to see.
I saw Steve White this morning at breakfast.
I'm sorry.
I haven't talked to him for years, but he was at the paper briefing when I was there years ago, and they were down in Pittsburgh.
IT and photo, I think, back in the 90s.
He didn't have a house at the time when I did.
Okay.
Kind of one of these guys.
He's really done that out nice, I think.
He went to really Shelton Village.
So this little step, the light doesn't look bad. It's just that big light on the top of you. So nobody has seen it. I'll take a picture and I'll show you sometime. You know those old, those like long beam artists?
They're really
He's got like a real, I don't know why it's so high up. Probably so it's out of his eyes. But it's not as high as like that speaker is. It's just one of those games.
Yeah.
Points down there.
Cool.
And then he's got like a little set, his little desk there, all those monitors.
Yeah, pretty good.
Congratulations.
Good. Mm-hmm.
When is this launch?
In case and federal lives and putting above contribution attitude. Law enforcement family who sacrifice never in response to order to read point nails stops check club allow use of lives. The necessary to fully gather more continue to be prohibited. We will continue to review the data and adjust necessary. For now, bar stay closed for care. Non or lead sources. Details of AS the whole point of being local widely rated. The win that is will only draw process. A little bit about cost lies local to us. The hospital is with resources and pandemic. And as all which creates a built-in delay in our ability to downward trajectory in new cases by onset date. We also felt confident in our ability to manage existing outbreaks as we increased our testing and contact tracing capacity. Over the past week, we saw that downward trend fluctuate and flatten, giving us pause. It illustrates that the disease is still spreading in our communities. We have heard stories across the world of how disease spread can quickly change the entire outlook of a community's recovery at a moment's notice, if reopening takes place too quickly or too aggressively. It has the power to undermine all of the progress established by months of quarantine and sacrifice. We need to ensure that we continue to have the public health capacity to effectively test, trace, and treat. That is why it's so critical to proceed with caution. We continue to feel optimistic about our trends on hospitalizations and death rates. Both indicators continue to decline. We will, of course, continue to monitor them closely, but we're confident that our hospital system remains well prepared and has done a really good job of maintaining capacity. But we cannot let up on our vigilance. Any large outbreak could put us back where we were. These promising developments in our state are because of our efforts to stay home, socially distance, and practice good public health hygiene. It is not an indication that the disease is gone. It is an indication that Kansans are doing a good job at managing it. We will continue to evaluate the state's disease spread, testing rates, death rates, hospitalizations, ability of our state and local public health authorities to contain outbreaks and conduct contact tracing, and personal protective equipment availability when determining if the state should move into the next phase. Regardless of the current phase, Kansans should continue to adhere to hygiene and social distancing protocols, including washing hands frequently while avoiding contact with one's face, remaining home when sick or running a fever, following isolation and quarantine orders issued by state or local health officers, and working remotely if possible. With that, I'll turn it over to Secretary Lee Norman of the Health and Environment Department.
Thank you, Governor. Good afternoon. Today, we're reporting 7,886 positive cases, which is an increase in 418 cases from Wednesday. You'll recall that we are now updating our website Monday, Wednesday, and Friday, so that's a 2-day increase. We have 53,706 negative cases and 172 deaths in Kansas, increase in 8 from Wednesday. Kansas has had a total of 94 outbreaks now. 39 are considered closed, meaning that the disease has run its course and there's no active cases in those 39, and 55 remain active. These account for 3,852 of the cases and 120 deaths. The cluster breakdown is always changes a little bit. 40 are in private companies, and 15 of those have run their course, 360 cases and 2 deaths. 24 long-term care facilities with 10 that are closed and have run their course, 591 cases including 96 deaths. 9 churches and other gatherings, 8 of those have run their course and are complete, 117 cases, 11 deaths. 9 meatpacking plants with 1,791 cases, 4 deaths. 6 group living situations with 54 cases and 2 deaths. 3 correctional facilities, Lansing being the predominant one, but also the Wichita Work Release Program and the Grossman Center, 917 cases and 5 deaths. And 3 healthcare facilities, 2 of which have run their course and no active processes there, 22 cases and 0 deaths. To reiterate, our testing strategy is getting more aggressive all the time. Our testing goal is for 60,000 Kansans to be tested in May. We're actually running ahead of schedule. The last few days, we're now running over 2,500 test results coming into our agency every day. Our lab is currently developing staffing strategies for increasing capacity to run 1,500 to 2,000 samples a day in our state lab. You may have heard that the Abbott rapid testing machine has come under scrutiny. There have been news reports that the FDA has received increasing number of false negative reports. Currently in Kansas, Abbott machines are not carrying most of the weight of our testing by any means, but we are using them in different parts around the state for testing on symptomatic individuals. The news about the Abbott test, first off, is really not news. Every testing platform and every test has a certain risk of false negatives and false positives. This news doesn't change our testing strategy, but it does fit into how a person is clinically evaluated. If we have a high degree of suspicion in a symptomatic person and the test result comes back negative, we will do a confirmatory test with the nasal PCR test, which is, again, not a rapid test, but takes essentially a day to get that test result back, because we want to make sure that nobody that's ill and tests negative slips through our fingers and goes undiagnosed. So we are, again, this is not news, and it's true in any kind of test. There's always a risk of false negatives and false positives, and we want to make sure that we use our best clinical judgment to evaluate our Kansans that are ill, and testing negative, we will confirm with a different test. Pediatric multi-system inflammatory syndrome. You may have heard about this. It has been cropping up around the world. Originally in the Netherlands, we've seen about 130 cases of this in New York State, about 60 or 70 of those in New York City. It's a rare syndrome, fortunately, but we've been talking all along how kids are relatively spared of COVID-19 illnesses. So this is something that we're going to watch very carefully. There's a young Kansan hospitalized at Children's Mercy that has this syndrome. The pediatric multi-system inflammatory syndrome is something that is a little bit surprising, and that is we've always talked about the COVID-19 as being a respiratory illness, but that does not seem to be the prominent feature of this particular illness. It is more of what we call a capillary leak syndrome, which means that it is decreased amount of blood flow and function to the vital organs like the heart, kidneys, and liver. Hopefully, this won't surface as a common outcome from the COVID-19. We'll continue to watch that. Seeking medical attention. We are hearing reports of people being hesitant to go to a hospital for emergencies. Hospitals have safeguards in place to protect you from COVID-19, and for that matter, many other infectious diseases. Hospitals are trained in the infection control practices, and I think that when you need to go to a hospital, when you have emergencies, or even routine scheduled care like shoulder replacements or knee surgery, et cetera, I think you can feel a great deal of comfort going there. Ambulances also have safeguards in place to protect you during your transportation. If you need medical assistance, go. By waiting, you risk far worse consequences. And one of the side effects you might say of COVID-19 is we've seen people that have stayed home too long and have come in with complications that handled earlier would have had better outcomes. Remdesivir, we've talked about that a couple days ago. We've received 10 cases of the remdesivir. This is an emergency use authorization granted by the FDA. It's an antiviral that may have hope for people that are intensive care, ICU type ventilated patients. Those 10 cases have been distributed around the state. That is enough to treat probably around 50 to 60 ill patients. We are expecting by 2 o'clock today to receive an additional 26 cases of the remdesivir, and we have a plan to distribute that today also. We are not stockpiling this at the state lab. We don't treat patients here in my agency in Topeka, Kansas. We want to push this drug out to where it's most needed, and that's, of course, with COVID-19 patients that are ill in hospitals. To that end also, I have a variety of clinicians we put together as an advisory committee to do two things. One is to help to refine the criteria as to who's the best client, the best candidate to receive the remdesivir. And then secondly, and importantly, we want to keep track how the people do. Are we using it in the right patients? So we'll keep talking about this as time goes on. It's still, I think the jury is still a bit out if it'll be, I don't think it's going to be the greatest magic bullet, quite honestly, in the world, but it may be an adjunct that can be helpful in certain cases. We'll find this out very quickly because there's thousands of the cases that are going out because there's many, many people in hospitals, obviously. Finally, masks. A reminder, if you go out in public for any reason, I suggest that you wear a mask. It's our guidance. It's also the guidance from the CDC. I wear my mask to protect you. It helps to contain the virus. If I were to have it inside my mask, you do the same to help protect me. Nobody likes them. And I will say that no single intervention that we do, whether it's school closures, whether it's stay-at-home orders, whether it's masks, washing hands, none of these things will take the risk down to zero. But every one of these things, including the masks, help to mitigate the risk to keep you as safe as you can be. One last thing I wanted to point out. Today is May 15th. I've been carrying this little thing with me. It's getting tattered. And it was the projections that we put together in mid-March. So 2 months ago today, essentially. There's all sorts of models you've seen out there as to optimistic, as to pessimistic, and then what do we think is the most likely. And the thing that I think is real gratifying, because we base our planning around this, and that is we've hit the numbers almost spot on every time. We use, in terms of cumulative cases, the governor's already commented on that. Of course, we'd like all these things to drop to zero, but it's not going to happen instantly. In terms of deaths, cumulative, we're below what the projected numbers were expected to be, which is a good thing. Hospital beds used in a particular day statewide for COVID-19 patients were on or below the projections. ICU beds on this day were on or below, and the number of ventilators were spot on. And the reason I bring this up is that early on, it's very hard to make projections. It's like in January making weather projections for a particular day or a week in April or May. You'd be kind of perilous to do that. What we, I think, have done is pull together a really solid team to do these projections. And we base our decision-making on this. And it's been comforting, I think, that we're pretty spot on for where we need to be. So that's the end of my prepared comments, Governor.
Very good, thank you. Any questions?
Governor, you heard him talking about the mask, how much it works and should work. Have you ever thought about requiring people out there to wear it, to make it the law, as it were?
Actually, no, and the reason is, I think if we were to make it mandatory, we would have people just make a statement, would not do it. I think it's better to let people take the responsibility to protect themselves and to protect others, and I would rather leave that decision to them, but in the meantime, give them all the information that we possibly can to encourage that they make the decision that works in their best interests and best interests of those around them.
On the subject of masks, with the legislature coming back next week, I haven't been up in the committee rooms. There's some talk that a lot of legislators are not wearing masks. How concerned are you about that? And I also heard there's some consideration when the legislators are here, the building is full, that you won't be here.
They could only hope. No, I will be here. But what the policy that we have laid down in the governor's office, now that the legislature has started to come back, they've been here for committee meetings this week. They'll be here for committee meetings next week, and then for sine die, next Thursday? And so beginning this week, every time we leave the governor's office, we put masks on. So whenever we're in the public space, we'll have masks on. I don't have the authority to mandate that to the legislature. That has to come from legislative leadership. They could do that, and we'll see what they choose to do next week.
When I came into the building today, the people at the security, checkpoints downstairs, there's a box of masks, and you're required to put one on if you don't have one on coming through. So is that administrative services that is doing that? And
Well, when I said I don't have any authority over the legislature, but the executive branch does manage the first 2 floors of the state capitol, so we can mandate that for people coming in on the ground floor. Mm-hmm.
Governor, do you have an idea of what it would take for K-12 schools and universities to safely return to in-person classes? What that might look like for the testing for students? Or
I'm going to let the public health guy answer that because, right now we're just sort of so far away from that, and that would be a projection. I think it'd be better to have somebody with some experience in that world.
Happy to, Governor. Matter of fact, I was just on the phone with the health officer of Douglas County, Dr. Marcelino, today. Had really good conversations, and I think it's fascinating. We have on one side we have public policy coming in through the reopening plan. The other side is we have public health principals, we have educational needs, even parents' opinions on what they want, and then throw in athletics, and it makes for a really interesting decision-making matrix. What I think is that I don't think it'll be business as usual come this fall. I think that's pretty safe to say. And you're seeing nationwide, the California state system has already announced they're not opening up in-person classes in the fall. You look at Northeastern University and other universities in the Northeast, they plan on opening up. And I think we're going to see a really odd mixture across the country. What I do believe is, and again, sticking with public health principles, and that is you do not want crowding, so it'll mandate that we take a different look at housing. I wouldn't be surprised if dorms would go to single rooms only, for example. Dining will be spaced out, I have no doubt. I don't think that competitive athletics is going to start on the schedule that they would prefer to. I think that will, if it occurs at all, with guidance from the NCAA and Big 12, et cetera, I think will probably be delayed at some point. Then you talk about schedules themselves and classrooms themselves. How much of that will be a mixture of online versus in-person? Will there be Tuesday, Thursdays, and Monday, Fridays, where people are alternate that? It is really going to tax the creativity, I think, of the educators and the administrators to think about the best ways to mitigate risks by installing those principles, the basic public health principles we've been talking about.
Does it make sense to test every student before they go into a school if they are doing in person?
I'm not overly enthusiastic about that, just because of the fact that the testing that would be done is at one moment in time, and as soon as you're 48 hours into it, then there's going to be more dependent on what the mixing of everybody's, presence, if you will, and what that could do. At what point do you say that it's just not practical? So I think it would be imperative to test anybody that's symptomatic, but beyond that, I think it would be chasing our tail all the time.
Doctor, with businesses open, workplaces opening, maybe schools, would you recommend that everybody gets their temperature checked before they come in? And that being said, how many are, is everybody with a temperature going to be the one infected, or are those that can be infected others without that temperature? What's the percentage?
Yeah, it's really good. So if I may summarize, the question is, does taking a person's temperature work, and if it's normal temperature, can they still have the virus and be infectious? And the answer, and the answer to that is we've learned that asymptomatic people, and with fever being one of those, can have the illness and be infectious. So that by itself will not do it. That's why the questions. Have you had any of these? Headache and muscle aches and cough and those other kinds of things are all added to it. And it's a crude screening, but it's better than nothing. And I think it's worth it. We do that in my building. I don't have my badges in my pocket. We have wristbands that show that every day that we come in we get screened. I think it's a very reasonable thing to do. One of these days when the overall disease burden drops, we might not need to do it anymore. To the governor's point, I think that being flexible, being resilient, being creative, we have a long road to go. And I think we just have to roll with it and listen, watch, and take the best advice possible. For now, that's the advice.
This is a question probably for both of you, but relative to the decision you made in the 1.5, phase 1.5, how did you arrive at the decision to, again, open up to a limited extent hair salons, nail salons, fitness centers, and so forth, when the proximity, when people are in very close proximity to one another when they're getting their hair cut or their nails done or something like that? So why those places and not the other places? What was the determining factor from a public health standpoint and from a policy standpoint?
Well, I think one of those factors was that there can be some control on the crowd and the distancing in those settings. The nail salons now, your barber shop, you'll have to have an appointment before you go, and they're not be allowed to congregate people in the waiting area. So that ability to do that, and then obviously the use of personal protective equipment will be important. And then, quite honestly, barbershops and nail salons and hairdressers are very equipped to sanitize. They do that anyway. They'll just ramp that up somewhat during this time. So we felt comfortable that they could do that. We will do a wait and see. I mean, if we find that when we reopen those, we have a big spike, we'll pull it back. But right now, we're comfortable going that way. Whereas in fitness centers, again, same thing with them. We're not allowing any group classes. So it's not like you can go to do your jazzercise next week. It'll be limited to individuals coming in essentially to use the equipment, perhaps to work out with their personal trainer at a distance. But it's, again, we can control the size of the crowd, we can control the distancing of the folks, and then the sanitary protocols can be put in place. So that versus some of the stuff that we didn't do. Like we'll open the fitness centers, but if they've got a swimming pool attached, no, can't use it. Can't go in the locker room to shower or change your clothes. If the restrooms are in the locker rooms, they can go in, but only to use the restroom, and they've got to come out. So it was just a matter of where can we control the environment versus where would we be out of control.
If I may add one, because you asked both of us, if I may add to the governor's point, these people have two things going for them. One is that they are very trained at infection control practices. That's part of their training, is how do you clean instruments, how do you clean surfaces, yourself, et cetera. And they have a vested interest in remaining well. And they are very motivated to one, get back to work, yes, but for that one person sitting in the chair, that's their one brief interval of time that they're there. But for that person cutting the hair every 30 minutes or something like that, they have a vested interest in making sure that they're adherent to those safety practices.
Governor, if my group class has less than 10 people in it in my fitness center, is that still allowed or is that not allowed?
Well, the question was if your group class has less than
10 people in
10
it?
people, no. No group classes at all in any of the fitness centers. You know, if you have a personal trainer and it's one-on-one, or you and your spouse go to the same fitness trainer as somebody you live with, then you could have two with the personal trainer as long as you're socially distanced. But no group classes other than that.
Secretary Norman, going back to the hair salon, if you don't mind. We've heard from some people that hairstylists that they're concerned about using hair dryers because that might be blowing the virus around. Is that a concern that they should have? Should we not be blow drying people's hair?
Yeah, the question is about blow drying and does that tend to aerosolize? And the answer to that is it's probably not. Now, we worry a lot about aerosolization of particles. For example, when we intubate a person and put them on a ventilator or putting something into their nose that's likely to result in a cough or a sneeze, that kind of thing. Those are viral-laden particles. The things that are, for the most part, and especially if they're masked up, both individuals, I might add, the risk is very low.
Yesterday, at the hearing relative to the unemployment situation, 40 years, I'm not sure I've heard so much vitriol in a legislative committee. I mean, your labor department and your labor secretary took a beating yesterday. And they're calling on you to treat this as the crisis that it is, that to open up temporary unemployment stations where people come physically and file their claims all over the state in the offices that aren't being highly utilized. Is there another strategy that you're considering to mitigate this situation?
Well, first of all, Jim, I have got to say publicly that I was appalled at the behavior of some of the legislators yesterday. And if they want to take cheap political shots, come after me. Do not go after my staff who are working day and night trying to help the people of Kansas. So with that said, are there other things we could do? No, it would make absolutely no sense to open up a bunch of temporary unemployment offices and have people mass gathering in there while applying for benefits. So no, we are not going to go do something that would be against public health procedures. Plus, even if they were to apply at a temporary office in Wichita or in Liberal, it still has to get into the computer system. That's the problem, is the computer system that is over 40 years old, that is held together by duct tape and gum, and needs to be replaced and should have been replaced. It wasn't. They started to replace it, then that process ended in 2011, and we were left with this. And Secretary Garcia and her folks and folks from other agencies that need to interface with labor for issues like this, were working for the entire year to fix that system and bring it up to today's standards. And then this hit, and they had to stop. So, I think that I really honestly believe that the folks over at Labor and the resources that we have poured in there, we brought in people from Department of Agriculture and other agencies to supplement the staffing over there. So whatever supplemental staffing could do to increase our response time or to shorten our response time, we've done that. So I really believe that they're doing what they can. Will we continue to monitor it and continue to respond to the situation on a day in and day out basis and pour in whatever resources we think will help? Yes, we will do that. But no matter what's happening over there, yesterday's performance in the Senate Commerce Committee was uncalled for.
Governor, graduations are coming up and therefore graduation parties. Can there be private parties for up to 30 people at a household? And what if it's an outdoor graduation party? Can you have groups of 10, socially distanced, like the restaurant philosophy we've implemented?
The mass gathering limit of 10 fewer remains. So that should answer that question. So no. In terms of graduations, actually some of our school districts came up with some pretty innovative ways of doing graduation safely, and so we've actually adopted some of those for our policies here, and that would allow them to do, inside graduations, but again, no more than 10 and socially distanced, or they can do drive-through graduations where they have the ceremony outside. Again, no more than 10 people outside the cars at any particular time, socially distanced, but they can do sort of creative graduation ceremonies, as long as they keep the 10 limit.
Governor, is it possible that we're going to see another, we're at 1.5 right now, will you kind of sneak in another phase if needed?
Am I going to do 1.75?
Yeah.
I was thinking about 1.83, but.
You're homeschooling people with these fractions.
Pardon? I was a math major when I went into college, so I find it fun. I'm hoping that in fact, it's hard for me to believe that we would make any change if we can't go to phase 2 or beyond next round.
Governor, there's a concern with cities and counties that have a budget problem now, that they may not be eligible for some of the federal funding because that funding has to be used specifically on COVID-19 response. I just wonder what you're hearing from cities and counties about their budget issue and what the answer is.
Well, the cities and counties are facing the same situation that the state is. The CARES Act, the stimulus money that came into the state, can only be used for COVID-related expenses, whether you're talking about state expenditures or local expenditures. So we're all in the same boat. The state has really significantly reduced revenues, and I know that the cities and counties are facing the same thing. So I feel their pain with them, and we are working with our delegation and with the National Governors Association to really put the urgency on the Congress that they need to do something else in a stimulus 4 package that provides direct relief to the state and local units of government to be able to fill those revenue gaps, because they're absolutely huge. We're probably in better shape than some of the states because we had that nice hefty ending balance. But I know some that are looking at major cuts now if we don't get some funding in from the feds to fill those holes.
Dr. Norman, relative to what happened yesterday in the legislature, them coming back, and the politics around all of this stuff, whether it's whether to wear a mask, whether or not, how fast to open this business versus that business, how difficult does that make your job in trying to come up with rational public health policy and enforcing it either by compelling people to do it voluntarily or otherwise? I mean, how much does that complicate what you're trying to do in terms of mitigating the spread?
Yeah, I would like to say that I'm unaffected by the naysayers that have not appreciated some of what we've done, but it is hard, and it is political. Lots of ideologic differences. I will say, though, I feel very comfortable with Governor Kelly, the administration, who's saying, here's pure public health. And I sympathize with Dr. Fauci. He comes very much at it as a pure public health person. And yet we can't be immune to the other considerations that really drive family health, personal health, mental health, and there, at some point, we must meet, and I think we've done a really good job meeting in the middle on this, and yet that doesn't necessarily play out with people on both ends of the extremes. So,
Specifically though, when people divide into their camps or into their tribes, somebody who might, under normal circumstances, be inclined to wear a mask but doesn't want to because they don't want to identify with this crowd, I mean, does it literally affect the effectiveness of the policies you're trying to do?
yes, it absolutely does. People will try to make a statement by doing something that's deliberately ill-advised. And it is a source of frustration. I try to judge it for what it is, which is a statement, and just try to keep sticking with the public health messaging that is, I think, pretty straightforward, actually.
I just want to comment on maybe the false sense of security that's perhaps developing from people. They see restaurants open, they might see a business open, they can go get their haircut now, life's back to normal. But we know based on the numbers, it's not. Would either of you want to comment on what they may be thinking?
Actually, I get a lot, I know there's a lot of noise out there about open up, open up, open up, but I also get a lot of please don't, please keep it shut, because people are afraid. And I think we're seeing that acted out in, even when we opened restaurants and allowed them, if you can have the table 6 feet apart and all of that, people aren't going. People are using their own judgment and their own sense of personal safety in deciding where to go, what to do. So what we're trying to do is set a safe baseline. What we think, if the businesses do it this way, it will be safe for you to go. But then I think it's up to each person to decide whether they're comfortable with that. So,
Governor, are any budget cuts expected for the coming fiscal year budget that legislators passed in March? Namely, will higher education in the state be cut in an effort to make up for the looming shortfall?
yeah, we're obviously looking at the budget very closely. It's my favorite thing to do anyway. And we have gone through line item by line item where we are. I think at this point, we're really only going to deal with fiscal year 20 and make sure that that's all secure. And with the ending balance that we have, I'm comfortable that we can get through the rest of this fiscal year without a lot of issues. We're going to wait to make some decisions about 21 to see what, if anything, the federal government does to assist us. Because, if you think back to the recession in 2007, 8, 9, at that point the federal government did provide a fair chunk of change, not nearly as much as they are this time, that we were able to use then to fill the gaps in our Medicaid program and in our education program. So we were able to avoid very, very deep cuts into both of those programs. So we want to wait and see. We don't want to make any decisions about 21, fiscal year 21, until we know for sure what the federal government's going to do.
One more question?
For both of you, I know Secretary Norman, a couple of weeks ago, you said that you had gone to a store and it was kind of chaos, and so you chose to leave. Are you guys feeling more comfortable going out, and what are you seeing if so? Or are you both, no, I'm staying home?
Well, I do like, I have to go out every now and again. And I always have masks with me. And if I'm not comfortable with it, if it doesn't look like it's a place that's been cleaned down, if the spacing isn't right, then I don't stay. The other side of that is I stick with principles. If I'm outside in an airy park and I want to take a walk and there's nobody around and I'm my dog and me, I'll take my mask off because there's no risk to me out there in that setting. So, I mean, I'm in the embodiment of public health principles. It is really about, especially when you think about risk mitigation, it's about indoors with crowds of people. And the setting is less important than that principle, indoors and gathers of people. It could be in packing plants, it could be in a prison, it could be in a nursing home, it can be in a candy shop. We had an outbreak, you remember talking a while back on a candy shop that had over 140 contacts we needed to trace that ended up leading to, I think, at least one death. The principle is that even a candy shop can be dangerous.
All right, thank you.
And I just don't get out much, but I haven't for about a year and a half anyway. So that part, going to stores and all those other kinds of things, it really hasn't changed that much for me. My husband is the one who tends to go to the grocery store, and he's always fully masked when he goes in, and I have no doubt that he would avoid a dangerous situation, much like Dr. Norman. But then I too do go outside. I walk regularly, and sometimes with a friend, but I'll always socially distance. So that and it's been good because there's actually a trail out in front of where I live, and people walk on that. And everybody, when they're coming at you, everybody's doing the same thing. Everybody is sort of providing that social distance. So I think it's a great thing to do. We all know that being outside, exercising is good for not only physical health, but your mental health. So I would encourage that, and I too subscribe to that's not the place you need a mask. You really need it when you're indoors with people.
Hey, listen, the backlog, I can't get an appointment. Can Ted cut my hair?
Ted is not licensed to practice hairstyling. He is licensed to practice medicine, so I can get you that. But he also couldn't see you until Monday anyway, so.
But you do need it.
Let Deb do it.